Citi News' first stop was at the Suhum Government Hospital, which is located a few minutes away from the Accra-Kumasi Highway. This facility has been the #1 referral center for majority of road accidents which occur on this stretch of the road, a situation that led to frequent shortage in blood. But according to management of the hospital, they have not recorded shortages since Zipline started its operations at Omenako.
The intervention of Zipline has we don't lose patients now because of blood. With the assurance of availability of blood, anytime, even there's an accident or a pregnant woman especially, they can easily run the patient to the theater and then they are sure that they can have blood when it is needed.
When Citi News got to Osino Health Center, which is also located on the same highway in the Fantiakwa South District, staff of the facility were waiting for a delivery from Zipline. Stephen Tete, the head of the facility, tells me their operations have improved.
Today we had a delivery service from Zipline. It had to do with an anti-snake serum. We had a case whereby we needed an anti-snake serum and we didn't have one in stock. So we had to call upon them and they were at our service. Within 10 minutes, they delivered the anti-snake serum.
On 24th April 2019, Government of Ghana launched the Fly to Save a Life project at Omenako, which made Ghana the second country in Africa, apart from Rwanda, to use drones to supply essential medicines. According to the management of Zipline, over 20,000 health commodities have been delivered to over 300 health facilities within the distribution centers in the eastern region.
So we currently operate from here, Omenako, and we are operating from the village of Mpanya near Asante Mampon. So from those two centers, we have been able to deliver over 20,000 different health commodities. The most interesting part about that is that last year, before the year ended, we had delivered about 15,000 health commodities since we started from April to the end of the year. But just this month, we've already delivered over 5,000 health commodities.
Zipline has acquired new generation drones called the Sparrow to augment the work of the Robin drones and is also currently working on a policy document with the Ministry of Health and other stakeholders to regulate the activities and ensure the services are not abused in a bid to improve their operations and services.
A few weeks back, we launched our new drone called the Sparrow, which is more stable, more reliable, can fly farther, can fly safer than our existing drone. So that is what we have actually brought in. And our third distribution center, which will be launching in a few weeks in the town of Vopsi, would be flying just the new generation type of drones.
For community members at Osino in the Fantiakwa South District, there has been a significant improvement in the healthcare delivery at their facility, and they want every government which comes to power to improve and sustain the activities of Fly Zipline.
It's my first time of seeing the drone delivery, and I think I'll first thank the government for making such a provision for all the hospitals, those that are in interior. I think it's going to help in case of healthcare delivery.
Madame Hannah Asante, a staff nurse and one of the two persons who survived a snake bite a fortnight ago, remains thankful for the timely delivery of an anti-snake serum by Fly Zipline. She couldn't hide her joy.
They called them to deliver it, so they brought it here. They brought it right to the hospital, at the back of the hospital.
It was delivered there?
Yes.
What time were you bitten by the snake?
Oh, at 3, let's say, Sunday night. And it came around 2 on Monday afternoon. Yeah, I was very happy because I was scared. I was scared about what happened. I was just waiting for them to do something about it.
Sustainability of Fly Zipline is solely dependent on the availability of essential commodities such as blood. Blood is about 25% of deliveries made by Zipline. It is also in short supply.
in Ghana as a whole, we don't do logistics supply in the night. So assuming you went to a hospital or a health facility in the night and you needed blood, for instance, and you didn't have someone who would donate blood at that hour, your chances are gloomy. That is one of the things we don't tell anybody in this country. If you need blood at night, emergency, it's one of the most challenging things to be in. But there are countless times where 8 p.m., 9 p.m., 11 p.m., people were on operating tables bleeding. They had run out of blood type for that person. They call us, and quickly our team springs into action and ensures that that health product is there. For me, that impact of saving those lives is the most tremendous thing that we could have done, and I'm proud, and the team here is so proud to be contributing in this way.
So on a normal day, the Zipline Center here at Omenako makes close to 25 deliveries, but on a very good day, they're able to make close to 60 deliveries a day, which is an indication of an improvement in the activities here in the Eastern region. For Citi News, Nel Ni Amati Kanaku, Omenako, Eastern region.